If you're dealing with hip pain, you've probably already tried stretching it. Maybe the figure 4 stretch. Maybe pulling your knee to your chest. Maybe both every single morning. And it still hurts. Here's what nobody told you. There are two completely different types of hip pain, and one of them gets worse every time you stretch it. If you've been stretching without knowing which type you have, you may have been making this worse for months. This video was made for you. It's not your hip flexors. It's not your piriformis. It's not even your posture. There are two types of hip pain, and they require the opposite treatment. Type 1 is compression pain, the joint is being squeezed. Stretching compresses it further. Every rep makes the damage worse. Type 2 is tension pain, the muscles are pulling too tight. This one responds to stretching. Most people are treating compression pain like tension pain. That's why they stretch, feel temporary relief, and wake up worse the next morning. The hip doesn't lie, but the advice you've been given might have been. Before you stretch one more time, you need a simple self-test, and I'm going to show you exactly how to do it in the next 3 minutes. Today, I'm going to show you 3 simple tests you can do right now at home in under 2 minutes to identify exactly which type of hip pain you have. No equipment, no doctor visit, just 3 movements that will tell your body's truth. Once you know your type, I'll walk you through the exact approach for each one, what to do, and just as importantly, what to stop doing immediately. And at the end of this video, I'll share one critical detail that most people completely overlook, something that determines whether any hip treatment actually works long-term. Without it, even the right exercises may only give you temporary relief. I've seen this detail change everything for people who had been suffering for years, people who had tried physio, painkillers, even cortisone injections, and were still waking up stiff and frustrated every single morning. So please stay with me to the end. You do not want to miss it. But first, let's find out which type of hip pain you're actually dealing with. Here's what's happening inside your hip joint. When you have compression pain, the ball of your femur is jamming into the socket. The surrounding muscles are actually trying to protect you. They tighten as a warning signal. When you force a stretch, you drive that ball deeper. More compression, more inflammation, more pain the next morning. With tension pain, it's the opposite. The muscles have shortened from sitting, inactivity, or old scar tissue. They're genuinely pulling. Stretching releases that pull and brings relief. Same symptom, opposite cause, opposite solution. Think of it like a swollen door frame. Sometimes the door sticks because something is pressing on it from outside. Adding force makes it worse. Sometimes it sticks because the hinges are too tight. Then you need to loosen them. Your hip is that door. The test tells you which problem you actually have. Before we get into the 3 tests, I need to say something important because I genuinely care about your safety, not just your progress. If your hip pain came from a recent fall or injury, please do not do these tests today. Get it checked first. If you've been diagnosed with a severe labral tear, advanced arthritis, or avascular necrosis, please work through these with a qualified professional beside you. If your pain is constant, even at rest, or travels down your leg with numbness or tingling, that may be coming from your lower back or sciatic nerve, not your hip at all. That needs a different conversation entirely. And if your hip has ever given out completely beneath you, sudden, total loss of support, please see your doctor before continuing. But if what you have is that familiar, frustrating, deep aching stiffness, the kind that's worst in the morning, or after sitting too long, or when you climb stairs, you are in exactly the right place. These tests were designed for you. Let's find out what your hip has actually been trying to tell you. Test 1, the compression test FADIR. Sit on the edge of a sturdy chair with both feet flat on the floor. Sit tall, don't slouch. Now, slowly take your affected leg and bring your knee up toward your opposite shoulder. As if you're trying to cross your ankle over the other knee, like a figure 4 position, but you stop halfway. Move slowly. There is no rushing this. The moment you feel anything, stop there. Don't push further. Now ask yourself one question. What do you feel, and where exactly do you feel it? A pinching sensation, sharp, catching, deep at the front crease of your hip, that is your joint telling you it is being compressed. That is a compression signal. If you felt that, write it down. Remember it. Because every stretch you've been doing has been recreating that exact sensation, and then adding force to it. A pulling or tugging feeling along the outside of your hip, or deep in your glute, that is a tension signal. Very different. Very important distinction. If you felt nothing at all, good. That rules out significant compression at this angle. The mistake most people make with this test is pushing through discomfort to get a better read. Don't. The signal appears early. Trust what your body says in the first 2 seconds of movement. Test 2. The tension test, hip extension. Stand facing a wall. Place both hands on the wall lightly for balance. You're not leaning, just steadying yourself. Now, keeping your knee straight, slowly swing your affected leg backward, behind your body. Think long and slow, like a pendulum. Only go as far as your body allows without your lower back arching or your pelvis tilting forward. Hold at the end of that range for 3 seconds. Then return. Do this 3 times. Slow and controlled each time. Now ask yourself, did that movement feel opening, like something releasing, decompressing, creating space? Or did it feel blocked, like hitting a wall from the inside? If the backward swing felt relieving, even slightly, if there was a sense of the joint opening up, tension is likely your primary driver. Your hip flexors, your psoas, your iliacus, these muscles have shortened. They are pulling the joint forward. Gentle, progressive stretching of the front of the hip is appropriate for you. If the backward swing felt jammed, painful, or immediately stopped by something deep inside the joint, compression remains your primary issue. The joint itself is the problem, not the surrounding muscles. Stretching the front of the hip will continue to recreate that jam. This is the test most clinicians skip. Takes 30 seconds and tells you more than most imaging reports. Test 3. The morning honesty test. This one requires no movement at all. Just honesty. Think back over the last 4 weeks. After your morning stretching routine, 5 minutes later, 30 minutes later, did your hip feel better or worse than before you started? Not during the stretch. After it. An hour into your day. If you felt temporary relief during the stretch but returned to the same pain or worse pain within the hour, that is your body's verdict. It has been giving you this information every single morning. You now have the language to understand it. Compression pain creates a predictable pattern. Momentary relief, followed by a return of symptoms, often slightly worse over weeks and months. Tension pain responds differently, relief that holds, that builds, that compounds over time. Your 4-week history is your most honest diagnostic tool. Now you have your answer, and in the next section we act on it. Now, the one detail I promised you at the beginning. The thing without which even the correct approach may not fully work. Inflammation. Specifically, what you eat every single day is either fueling your hip pain or quietly helping it heal. You don't need a complete diet overhaul. I'm not asking for that. Just one small shift. Reduce the foods that keep your joint inflamed, processed oils, refined sugar, ultra-processed snacks, and add one anti-inflammatory food daily. Your hip cannot heal inside a constantly inflamed body. No exercise fixes that. So tell me in the comments, which type did your tests reveal? Compression or tension? Just write one word. I read every single one. If this video finally gave you language for something you've been feeling for months, share it with someone who's still stretching without answers. And if you want to go deeper, my next video covers the exact exercises for each hip type, compression and tension, step by step. Remember, your age is not your cage. Your hip is not your sentence. It's never too late to move better.